What would you do if you found out someone could have saved your life but they chose not to? Well, we all are faced with this question every time we get asked if we want to donate blood. When we donate blood, we are saving countless lives that we will never even know. I've been actually donating blood for over 3 years now, and it feels great knowing that I can help everyone, and I just want everyone else to have the feeling that I've had for the past 3 years. We'll talk about the different aspects of donating blood, why it's important, and why there's such an increase in the need for donation. Like I said, I recently have donated blood, and I have to say it was pretty great to know that I helped people. When you go to do it, they ask you some questions, and then they make sure you're able to do it. Like, they want to make sure you're in the proper weight categories, the proper height categories. They want to make sure you are at physically fit and physically can do it, so you don't have any serious side effects. So then after that, whoever would do it, you get escorted to a bed, and then they sit there and they talk to you, and they let you know what they're doing. And they find the vein, which is usually right up in here. They find a vein for it, and then they fill little test tubes, and they do a little bit of tests on that, and then they get a pint of blood. And it's takes about 20 to 30 minutes. It can take less, can take more, depending on individual needs and stuff. And then there's just, after that, you get to this little canteen area, you get some drinks. Most of the time there's cookies, so cookies are always nice. And it's just really nice. And American Red Cross says you can save 3 lives by just 1 donation of blood. And according to Medical News Today in 2007, as a result, it is possible for a person who is donating blood to identify unknown health conditions, because in those test tubes, they go and they run tests to look for different medical conditions that are passed on through blood or bodily fluids. So that way they can make sure it is good to get to the other patient, so they're not spreading diseases or any ailments. So it's just better for both people individually. Why it's important is because there's so many people that need blood donations. In a blood donation, you have the blood itself, or they can take it out and use the platelets. The platelets are used for cancer patients to help boost their immune system, their cells. Those platelets are helping the cancer patients. And why just doing it is because someone every 2 seconds needs blood by Web Medical in 2018. That's a lot of people. If you think 60 seconds in a minute, that's 30 people every minute that need blood. We don't have the blood supply in the United States to keep going at this rate, to have 30 people every minute need blood. That is an astonishing number to me, I found. And then, like most things, there's really one good type of blood that's used in emergencies. When you come into the ER and need blood before they can identify what type of blood you are, that's O negative. And according to HuffPost in 2017, only 7% of the U.S. population has O negative blood, and even less than that actually are frequently donating to blood supplies. Now, you'll need, like I said, cancer patients will need it. But if you come in for an emergency and you've lost a fair amount of blood, you get a blood transfusion right there. Major surgeries are another thing where blood transfusions are used. And we all know someone who's needed a major surgery that resulted in some sort of blood loss. And then anyone who has hemorrhaging or bleeding after a pregnancy, they are given a blood transfusion. Now right there, that covers such a broad spectrum of what hospitals and ERs go through that it is astonishing that there's not more people donating blood. And needs are on a rise because in the summer, the rate of blood donations drops so much, but accidents don't slow down. They're actually increasing a little bit because we're all out in the open, in the public, in the air, wanting to drive around. A high-speed crash on the interstate in South Dakota is 80 miles an hour. Both cars roughly going 80 to 75 miles per hour. That car crash, most of the time, the people who do survive it do need a blood transfusion because they have so many cuts down their skin and everything that they've lost a fair amount of what's inside them, that they need this blood transfusion to fight back and to heal and to bounce back from this accident. Also, natural disasters are another big reason why blood supplies come in such short demand. A natural disaster happens, an earthquake, tsunami, tornado, anything. A lot of those people have been banged up, cut, lost so much blood, and the people who are found even later after it need the blood again too, because they've probably been sat there and are bleeding out. They will take what supply, whatever is just they're holding on to just for a little bit, that supply disappears. And like this coronavirus, the blood supply disappears because they still need it. So there's so many things that affect the blood supply in the United States that I'm not surprised more people aren't donating to help save more people's lives. One thing that takes an hour of your time saves 3 lives, and I still don't understand why people are not donating. Yes, it's scary to have a needle in you, and I kind of freak out a little bit, but I don't look at the needle at all. I sit and I'm on my phone reading a book. I'm doing something else. I'm not thinking about the needle in my arm. That it's like, and I also think about, okay, I'm helping people. Like, I'm saving lives here. So it's very important that we should do this and just help everyone. Because like I said, there's different aspects, like you can donate the blood or the platelets in your system to help both, like so many more people. It's always important due to the amount of people that are in having to do major surgeries or the amount of car crashes or just any accident that walks through an ER. A hospital needs to have a blood supply to save those lives, and we as civilians can help them do that by donating blood. And there's just always a greater increase as time goes on because there's less and less people doing it. So I urge everyone to really consider donating blood the next time they're asked.